All right, part E is going to be the adrenal glands and the glucocorticoids. Adrenal glands, of course, they sit right on top of the kidneys. They produce hormones that help regulate chemical imbalances. They regulate metabolism and supplements other glands. They produce sex hormones, testosterone and estrogen, mineralocorticoids or aldosterone, and glucocorticoids, the cortisol and corticosterone. The adrenal gland itself reduces epinephrine, norepinephrine, and dopamine. So there's a feedback loop from the hypothalamus through the pituitary, the adrenal cortex, producing cortisol, which increases the blood pressure, the blood glucose, the amino acids, and all of that, and that gets back up to the hypothalamus, which inhibits further release of the corticotrophin releasing factor. So it kind of just moves around in a circle. When that circle malfunctions, disease processes happen. So glucocorticoids, some of the medications, we've talked about these already: prednisone, dexamethasone, and hydrocortisone. These inhibit all stages of inflammatory response. They reduce circulatory lymphocytes, reduce macrophages, and depletes eosinophils. The name glucocorticoid is derived from the early observations that these hormones were involved in glucose metabolism. When food was being taken into the body, they stimulate production to stimulate processes to increase and maintain normal glucose concentrations, which is why they're called glucocorticoids. They stimulate glucose production, stimulate fat breakdown in adipose tissue, and inhibit the inhibition of glucose and fat storage. So that's what glucocorticoids do. They're anti-inflammatories. The anti-inflammatory corticosteroids. They're immunosuppressive. They're used for arthritis and allergic reactions, inflammatory bowel disease, dermatitis, asthma, and autoimmune diseases. They're also used for things such as organ transplants, again, to reduce the immune response in the recipient. You want to have an immunosuppression effect so that your body keeps that new organ in. So they have a lot of powerful effects. And this chart kind of shows how the body normally produces or releases the dosing of cortisol into the body. Glucocorticoids should be given in the morning between 6 and 8 a.m. Once daily dosing is usually preferred. Large doses are usually going to be split up to minimize GI upsets. But if it's a small dose, early morning is best, because if you notice this, you peak at about 8 o'clock in the morning, and then you continually drop down until midnight, where you start to climb back up. So if you give it in the morning, you are simulating the body's normal cycle, which is the best for the patient. Cushing's disease. This is an excessive production of ACTH by the anterior lobe or by the adrenal gland itself because of a tumor. Impaired wound healing predisposes the patient to subcutaneous or fungal infections. There can be redistribution of fat, purpura, acne. At low to medium doses of corticosteroids, there's no increased risk of infection. That usually occurs when there's daily doses greater than 50 milligrams. Glucocorticoids decrease the inflammatory response to infection. A major side effect, and there are many side effects of these, but Cushing's disease, think truncal obesity. The abdomen, the gut, that whole area just gets very obese, focused in that part of the body. You can develop, it's called a buffalo hump, or tissue up on the shoulders. You can have thickening skin. So there's a lot of different things that can happen. Other side effects: diabetes, osteoporosis, peptic ulcer disease, hypertension, hyperlipidemia, anxiety, insomnia, depression, and euphoria. This suppresses intestinal calcium absorption. So approximately 1 out of 5 treated for 1 year will develop skeletal problems. They need bone density exams on a regular basis to ensure that their bones are not becoming fragile. Psychiatric symptoms occur with increased doses over 40 milligrams a day. Symptoms tend to occur during the first few weeks of treatment and generally subside when the therapy is discontinued. Usually there's a complete recovery. If the symptoms must be managed medically, phenothiazines have been effective, but tricyclic antidepressants worsen the symptoms. Calcium supplements and vitamin D supplementation is strongly recommended. Weight-bearing exercise and reducing alcohol consumption is also strongly encouraged. We're going to taper off corticosteroids carefully. We're going to taper the dose by usually 2.5 to 5 milligrams weekly. In general, patients receiving therapy for 2 weeks or less may have therapy discontinued without tapering, but longer doses you will taper off slowly to prevent an adrenal crisis. An adrenal crisis is critically important to watch out for. Do not discontinue these medications abruptly. Glucocorticoid therapy must be gradually tapered to avoid rebound effects. When people are treated with glucocorticoids for a long period of time, the production of adrenal hormones actually decreases because of the effects on the pituitary. If glucocorticoids are stopped suddenly or decreased too quickly, the adrenal glands may not begin making their own hormones again fast enough to meet the body's needs, and the symptoms of adrenal insufficiency results. This usually does not occur with topical or inhaled forms of corticosteroids. So some symptoms of adrenal insufficiency: weakness, lethargy, fatigue, nausea and vomiting, arthralgias, myalgias, low blood pressure, shock, death. So critically important, you taper these off slowly. We're going to watch out for symptoms of adrenal crisis. How are we going to do that? We're going to check heart rate, pulse. We're going to ask them, how do you feel? Is anything wrong? We're going to talk to our patients. Patient teaching. Again, we're going to avoid people with infections. If you're taking larger doses, we don't want to expose you to an infection because of the reduced immune response because of these corticosteroids. If you develop a fever, weakness, or sore throat, you need to report it to the doctor. Monitor your glucose levels. If you're diabetic, you very much need to monitor your glucose. If not diabetic, your doctor will probably check your blood sugars before starting you on corticosteroids, especially larger doses. Take it at the same time each day in the morning. Ideally, especially with smaller doses, same time in the morning. Take it with meals or food. These can be very hard on the stomach, so you don't want to add nausea and vomiting on top of everything else that's going on. So food or milk will help reduce the GI upset. Do not stop abruptly. Even if you're taking small doses, you probably want to make sure you don't stop abruptly. And watch for weight gain. You can gain weight very rapidly on corticosteroids. Remember, they promote eating. They can promote water retention, so you want to monitor your weight carefully. That's it for the endocrine system. Next learning plan will be analgesics and the musculoskeletal system medications.